The shade is determined by means of the chromoscope shade guide. The living tooth mold charts provide further assistance in selecting the appropriate shape and shade of the teeth. The initial situation. The current oral situation of the patient shows clear deficiencies. This finding is confirmed by the physiological rest position and the centric position. Initial impression. After examining the anatomical oral conditions, position the empty mandibular tray on the mandible and check if the tray smoothly runs along the alveolar ridge without causing any pressure spots. Then insert the maxillary tray and again check the fit of the tray. It is advisable to use a hand-mixed alginate to take the first impressions. Centric tray. The centric tray permits the transfer of the occlusal position to the individual impressions. In addition, the tray allows the physiological unity of the stomatognathic system to be maintained. To record the occlusal height, apply marks on the nose and chin of the patient prior to impression taking. Record the distance between the marks with a sliding caliper. Slide the support wings onto the retraining track from the dorsal. Try in the centric tray and trim off any interfering areas. Mix impression material and load both halves of the centric tray. Insert the centric tray sideways into the oral cavity. Advise the patient to close the mouth slowly until the marked occlusal height is reached. The mandibular and maxillary impressions are sent to the dental laboratory together with the centric tray. The gnathometer M with the UTS adapter, the intraoral registration of the Gothic arch, is an efficient way of determining the maxomandibular relationships in edentulous patients. Check the individual trays with the bite rims in the oral cavity. The bite rims should close completely with the load being evenly distributed. Next, take the individual impression using a silicone impression material. During impression taking, the antagonist tray remains in the